Hello, and welcome to part 3 of the medical advocacy training. In this portion, we will begin talking about some of the common medications a survivor might receive. In this portion, we will be talking most specifically about pregnancy prophylaxis. Every hospital is required to inform about emergency contraception. If it is not medically contraindicated, they must provide it immediately at the hospital to victims of sexual assault who request it. This is the Washington state law. Administration does not mean writing a prescription, it means administering it. You are not required to complete a sexual assault kit or report to law enforcement in order to receive this prophylaxis. Minors of certain ages will have the same right, and we'll cover that in a later section. It is best practice to have a pregnancy test performed before administration. Pregnancy prophylaxis within the hospital typically includes something called the morning after pill. This is Plan B or Ella. Be aware, though, that most hospitals only have access to Plan B. These are typically effective up to 5 days after sexual assault or rape, but Plan B is typically most effective within the first 3 days. This is from the Washington State Health Department. Just some big things to take away from it. It also lists that RCW for the requirement of the hospital to administer the pregnancy prophylaxis. Some things, it talks about how it works. It works by keeping an egg from leaving the ovary and possibly from keeping the sperm from meeting the egg. However, it will not stop an active pregnancy. It is not an abortion pill. Some things to note. The survivor may have more or less bleeding than normal on their next period. Their period might be late or early, and they may experience some of the normal side effects of daily birth control pills, including nausea, stomach pain, breast pain, headache, fatigue, or dizziness. In the next section, we will go more in depth over the rest of the medications that may be administered during a sexual assault